So let's begin with abuse. You have got a scenario of non-accidental injury. You are an FY2 at the pediatrics department. 4 months old male child named Andrew was brought to the hospital by his mother with a swelling of the left arm. X-ray has been done, which shows spiral humeral fracture. Child is with the nurse at the moment in the room. Talk to the mother, take a focus history, and discuss initial management plan. Okay. This is scenario A, and scenario B is the same scenario, but here uh, the boyfriend's name is Tony and he works as a builder. He's not the biological father of the child. Okay. And in scenario A, the parent or the boyfriend's name is coroner. All right. So these are two different scenarios, but with the same approach. Just the names are different and the duties or the works, occupations of both the boyfriends is different. Rest is the same. Okay. So mother is here to talk to you. She brought her son and he was diagnosed as a case of non-accidental injury. Doctor suspected after going for x-rays, doctor suspected that he is having non-accidental injuries, and now the nurse has asked you to talk to him, or maybe your colleague has talked to ask you to talk to his mother. Okay, so you are going to talk to the parent. So she has got some questions that what are you going to do for my child, and because she's not interested to see any consultant or anyone else, why are you not letting her see her child, and why are we going to admit her child? And she thinks she's asking that whether she's a bad mother, and why can't we treat the child and let him go, and what are we going to do for him now? And if we ask them, or if we inform them, okay, we are going to involve social services, mother won't be happy and she would be showing concern that they might take my child away. And she also asks the reason that why did this happen to my son, who did this to my son. Okay, so you need to answer all those questions. These are a lot of concerns. So let's see how to approach. Your approach should be supportive when you are going to ask these questions, because mother might get offended, because on one side she has her son and on other side she has got her boyfriend. So initially she won't be believing, or she might get offended when you discuss it with her. So there is an approach that how you would approach this station. So your approach should be supportive. Greet the patient, build rapport, introduce yourself, paraphrase the scenario, and then with a smiling face, you can continue the station. You should know the name of the patient, that is Andrew, and again smile, shake hand, maintain eye contact. It says shake hand, but these days we do not shake hand. And maintain eye contact loud and be confident, and confirm relationship to the child. Okay, are you mother of Andrew? Okay, so then you need to paraphrase the scenario, that okay, I understand that you brought your child to the hospital with a swelling on his arm. Okay, and then you need to check her prior understanding, that what have you been told so far about Andrew's condition. And then she would say, the doctor, I do not know. This is one way of starting the scenario, but other way is that she might be really worried. The moment you enter the room, she might not give you a chance to speak or to start the grips, and she might say, doctor, how is my child? She can ask this way, and then you have to start with type 2 introduction. Okay, pardon, can I confirm a few details before we talk about your child, and then you can continue. And then you need to check her prior understanding, and after that you need to explain the x-ray result, that okay, I understand that he had an x-ray done, and has any been there to explain the results of the x-rays to you? Then you will be explaining. She would say, no, doctor, nobody. You are the first person I'm seeing. Then you would be saying, okay, let me explain it to you. Unfortunately, the results of the x-rays are of some concerns, or the results of the x-rays do not include a good news. Unfortunately, Andrew has sustained a fracture of his arm. And then you pause here to allow the news to sink in. And mother might cry, or she might be looking down, or she might get tensed. and she might be really worried. So what you can do is you can follow that Eve protocol, and you can offer her with tissue papers. And also, if she still cries, then you can ask her to call to you can ask her for a glass of water. Okay. And avoid talking to the patient, that's a mother, as because if she is still distressed and she is still looking down, do not be in a hurry to offer tissue and followed by a glass of water. So you need to wait as long as mother is looking down. Let her show her emotions. Okay. So you need to allow for the news to sink in. Okay. And then after that, what you need to do is you need to take initial history. And before taking that history, you need to signpost that, okay, I just wanted to ask you some questions just to just to have a better understanding how Andrew has sustained this fracture. Is that okay with you? And then you go on asking your questions that, okay, when did you notice it? How did you notice the swelling? And do you have any idea how he could have sustained this injury? Is there any chance he could have fallen down? Who was with the child at that time? And when did you last see Andrew? Okay. Was Andrew fine the last time you saw him? Who was looking after him? Did coroner ask about the boyfriend? That, okay, did Connor tell you anything in terms of how Andrew sustained this injury? How are you related to Connor? You need to ask about her boyfriend as well. Okay, is Connor the biological father of Andrew? Did you ask Connor if he knew anything or anything could be the cause of swelling? Okay. And might be he might tell you that this mother might tell you that, okay, my boyfriend told me that my son had a rough night. So you can ask, can you tell me that what did he mean by rough night? Okay, you need to explore. And then you need to signpost into child abuse history. That, okay, the type of fracture, let me tell you that the type of fracture that Andrew has sustained is called a spiral fracture. It is quite a big fracture, and to sustain this type of fracture, it requires a big impact or fall from a height. Okay. And there are certain concerns that we are concerned that this may happen again. Okay. So I think we need to try and get to the bottom of things in terms of how Andrew sustained this fracture. And I just wanted to bring into your attention that the majority of the patients usually are excellent at taking care of their children, but unfortunately, a small number of parents do abuse their children. Okay, you have to ask this way. You won't be straight away going and asking, okay, I think that you might be abusing your child. No, you have to sandwich your questions. There's a way of asking. When you are going to ask the information from the patient attendant in this manner, they won't get offended, and also they will be cooperative. They will be giving you information. You are going to disclose things slowly and gradually to the mother. So then you need to say that, okay, that's why we are encountered with the situation. We were not satisfied with how the injuries were sustained or how this fracture was sustained. So what we do is we do ask some specific questions about child abuse. And I need to, in this regard, I need to ask you further questions about how you are living at home, just to get a better understanding of things. Okay. So you will be asking like this. And then after that, you start with that, okay, tell me, how are the things at home in general? Do you have any idea how he could have sustained the fracture? Is there anyone else who looks after Andrew other than you and your boyfriend, that is Connor? And does Andrew go to nursery? And do you sometimes take him to any childminder How is your relationship with Connor? Are you married? Are you still in contact with Andrew's biological father? Does he have contact with Andrew, or does he contact Andrew? Do you have any reasons to believe that Connor couldn't have done or could have contributed to these injuries? Okay, you need to ask all those questions what you have in your mind to rule out child abuse. You can ask, you can signpost, and then you can ask. You have to, and then after that, you need to ask that, okay, has Connor ever been aggressive towards you? Maybe by shouting or intimidating or saying things, or has he ever put you down? Okay, and ask her relation with her boyfriend, that okay, how is your relation with him? We know that sometimes children can be a little annoying. Has anyone, either you or Connor, been abusive towards Andrew, or have you beaten your child? Okay, and you also mentioned that Connor said that Andrew had a rough night. So did you try to ask him that what did he mean by it? Okay, and then uh, w- uh, she would be telling you that, okay, doctor, I was on my job, or I went to office, and Connor was looking after him at home, and he is very nice, and he has never done such things. She won't be believing. She would be she, because this a news, this something new to her, so she won't be believing. Okay, and then what you need to do is that, okay, you need to assess for any risk factors for non-accidental injuries. And what are those risk factors? These risk factors could be unplanned pregnancy, okay, any financial problems, any problems with housing. For example, you need to ask that, okay, was this pregnancy planned? Okay, and do you have any financial problems, any problems with the a job, any problems in your family? Okay, you need to ask all those questions. And then any problems where you live. Okay, and then what you need to do is you need to assess for domestic violence. And okay, sometimes some women tell us that their partners abuse them. Has Connor ever been abusive or aggressive towards you? Okay, these are the things which I have mentioned to you earlier. That okay, has he ever been aggressive towards Andrew? And then take child's past history. That is he up to date with all his jabs? Are you happy with his development? Were there any significant events or any complications soon after the birth or during the pregnancy? You can take a quick child history, okay? And then summarize everything and signpost into summarizing that, okay, let me go through everything that you have told me so far. You have listened to her, and then you would be telling that, okay, you have told me that you came this morning from work and noticed a swelling on Andrew's arm, and you took him to the hospital. And Connor told you that Andrew had a rough night, and when you tried to ask him further, he did not give you any further information. Okay, and um, uh, and how do you feel about all this? Okay, so would you like to know that how Andrew sustained this fracture? Okay, and then she would say, yes doctor, definitely I would like to know. Please tell me what, how did it happen, and what did do, what did what are you going to do for my child? Okay, and then you would be narrating the whole story that this could be, as you already told, that this is a spiral fracture of the humerus. It requires a huge amount of force, or somebody might have it requires rotatory force because it's a spiral fracture, and somebody grabs one's hand and then rotates the bone. So this sort of fracture can happen. So it is a sort of abuse. So we are suspecting it. And then what are you going, how are you going to manage it? Discuss the management plan. What you will be doing, you will be managing medically, because he has got two issues. One is abuse and other is the medical issue. So you are going to address acutely this medical issue because he has got a fracture. And you would be telling the mother that, okay, we are she would be asking, what are you going to do? You need to ask, tell that mother that, okay, we are going to admit Andrew, so that he can receive the treatment for the fracture. And she will be saying, doctor, why can't you just treat him and let him go home? So you would say that unfortunately, it is not a treatment that can be done in a day. We will refer him to orthopedic team who are the bone specialists. You have to explain about the team, that what are their roles, and they might need to perform an operation. We do not know about that, okay, because they would be further managing this fracture. But unfortunately, it is not possible for him to receive all the treatment in one day. Is there any particular reason? Explore their concerns. That is there any particular reason you do not want him to stay in the hospital? Okay. And she might tell you that, okay, doctor, I'm working in an office, so it is difficult for me to live with him in the hospital or whatever. She might tell you any concerns if she has. Okay. And then she would be saying, okay, doctor, why are you not letting me to meet my child? So you would be telling that, okay, I'm sorry, we made you feel this way, but at the moment, Andrew is receiving treatment. He is uh, with the nurse, and because he has sustained such a serious fracture, we need to make sure that he receives appropriate uh, pain treatment, okay, painkillers. And I also need to talk to my seniors about the whole situation because I'm a little bit concerned about Andrew's fracture. And then this was all about medical management. And then you have to you have to manage for abuse. So what is the management? You would say that I think it is sensible in this situation to get to the bottom of the problem, but I'm afraid that it would not be possible to do this without talking to your boyfriend, that is Connor, or either it could be Tony, who was with him at that time. I think we need to perform further assessment in terms of where you live and talk to Connor as well. I'm sure it is something that you want as well, so that it doesn't happen again. We need to make sure that it should not happen again. And then, unfortunately, as a medical professionals, tell her that it's our duty that we do not perform this assessment ourselves. So we would pass it on to relative authorities who are responsible for safeguarding the rights of the children, and we call that team as social services. And I'm afraid that we need to refer your child to social services, and they are the ones who normally perform this type of assessment. To begin with, this is only an assessment, okay? They will just be initially assessing your child, and they will come to your home, and they will be she would be frightened, or she might get worried that, no, doctor, why are you referring, why are you involving the social services? And you have to tell that, okay, she might say that, doctor, they might take my child away. So you need to tell that, no, it is not the case every time. What they do is they would come to your home, they would talk to you and Corner in personal, and then they will reach the bottom of the situation. And if they will give you warning, and if they find that the child is not safe with you, then this could happen, that they might take your child away from you, okay? And they might be offering some suggestions to change. If there is some problem at home, they might give you some suggestions to address that problem, okay? So tell her that, okay, what do you think about our discussion so far? And then if she has any other concerns, you need to address that, okay? So this is we have discussed these two scenarios. Approach is the same, that what are you going to do is, first of all, you will greet her, and then you should be knowing the name of the patient, so that you have to talk to the mother, and then confirm the relationship, paraphrase everything, check her understanding, explain the results, and signpost into initial history taking, and then signpost into child abuse history, risk factors, rule out any risk factors. Maybe it could be an unplanned pregnancy, okay, and address any problems with the housing, living, any problem with finances, or any violence at home. Assess for domestic violence, child's past history, summarize everything, and then discuss the management plan, discuss about medical management, and then the abuse management. Okay, so let's move on to the next station. One of the candidates asked me yesterday that, okay, what are the scenarios or what are the conditions or the cases where we can breach confidentiality? So let me tell you that domestic abuse, I told yesterday, I answered it that, okay, whenever there is threat to a person's life, person's own life, or another person's life is at risk, or public interests are at risk, so you need to breach the confidentiality. And this is one of them. Domestic abuse is one of those scenarios where you can breach the confidentiality. Apart from it, whatever you discuss with the patient remains between the doctor and the patient. Okay, so let's look into this scenario. You are FY2 in the emergency department. Mrs. Sandra Brown is a 30 years old lady who has presented with pervaginal bleeding. She is 12 weeks pregnant. She is concerned about her pregnancy. She had requested to see the doctor urgently. An ultrasound scan of pregnancy is normal and shows a normal 12 weeks pregnancy. The nurse has examined her and found bruises on her arms resembling grip marks. The nurse also found cigarette burn marks on her arm. Take a focus history and discuss the initial management plan with the patient. So, how are you going to approach this scenario? You are going to start with grips with a normal smiling face, introduce yourself, build rapport, and state the purpose, and then paraphrase that, okay, hello, Sandra. Is it Sandra Brown? All right. So I'm Dr. Amma, one of the doctors working in this department. So how are you doing? And I understand that you had a scan. Has anybody been here to explain about your scan? Okay, this is one way of starting. But the other way is the patient might be really worried because she's worried about her pregnancy. She might not give you a chance. She might say, doctor, please tell me about my baby. How is my baby doing? So you would be just giving a journal answer that, okay, well, with a smiling face, that, well, there's a good news that your baby is fine. We just received the scan report, and the report says that your baby is doing quite fine, quite well. Okay, so so you don't need to worry about your baby. And then what you need to do is uh, you need to ask about. You have to raise your concern. Okay, first you discuss the scan report, and then you have to discuss your concerns. That, okay, she might be saying, the doctor, okay, all right, my baby's fine, so I need to go home. I would like to go home. But you would be telling that, okay, that's okay, I understand. You should be able to go home. And I was wondering if I can ask you a few questions before you can go home. Is that okay? So then you will start the conversation and raise your first concern that I can see that you seem, because you need to pick up these things from her body language. She will be anxious. She might be fidgeting, or she might be feeling uncomfortable. So you can, whenever you see it, say it. That, okay, I can see that you seem a bit uncomfortable. Is there anything that's bothering you? Is everything okay? Okay. And she would say that you need to pick up those non-verbal cues. Okay. It's a part of your IPS and it's part of your station. And then you need to ask the questions. And then she might not answer anything. She might be looking down, and give her some time to reply or respond to your concern. But if still she's not responding, then you can raise your second concern that I understand that you had some bleeding. I would like to ask, how did you develop this bleeding? Are you still bleeding? Okay, you can ask these questions. And then you need to offer confidentiality. You need to offer confidentiality because the patient might not be opening up, and you need to offer confidentiality. And you have to emphasize, make sure you emphasize over it that, okay, I would like to assure you that whatever we discuss here will remain between us. I just want to make sure that you are okay. Okay, any information you give us won't be released to anyone. We need to make sure that you are safe, and just make sure that you do not develop similar problems in the future. So this is a way you can offer confidentiality to her. And then you have to raise your third concern, because there are few concerns in the scenario given that, okay, One of the nurses mentioned that you have some bruises over your arm. Can I have a look at the bruises? And then she might tell you. And after you look at those bruises, and after inspection, you can ask that, okay, can you tell me how did you sustain those bruises or this injury? And it seems that someone has grabbed your hand, isn't it? So then, if the patient still does not answer, so you have to give some time to the patient for their answer. And if still patient says that, okay, I'm not allowed to talk about this, doctor, so then you need to reassure, you need to provide confidentiality, and then you need to offer her that, okay, who's not allowing you to talk? Uh, do not be afraid of anyone. Whatever we discuss here will remain between us. It won't be conveyed to the person you are afraid of. Okay. And then she might tell you, uh, uh, the patient does not, if maybe she would be telling you, or she might not tell you, but if she's not opening up, then you can ask a direct question. Okay, you can ask a direct question from the patient about this, that okay, some women come to us and tell us that their partner abused them. So has your partner ever been abusive towards you? Could this be the case with you, that your partner has abused you? Has he ever been abusive towards you, physically or verbally? Okay, so you need to ask those direct questions over here. And if the patient admits domestic violence, ask about all the issues. Can you tell me what happened? How did he do this to you? And is this the first time he has done this to you? What about the bleeding you had before? How did you sustain that? Did he cause this bleeding to you as well? You can ask. Okay, if there is anything else in the task, like burn marks, as it has been given here that she has some cigarette burn marks, so you bring it up. You tell her that, okay, I've also been told that you have burn marks on your body. Are you able to show me those marks, please? And how did you sustain those marks or those injuries? And then ask ask further relevant history about abuse. That, okay, who else is at home with you? How long has your husband been abusing you? Does he ever try to put you down? Has he ever threatened to kill you? Do you have relatives? Where are your parents? And do you have any friends? Have you ever discussed your problem with anyone, including your family, your parents, or your friends? Do you have any children at home? How old? If she says, yes, doctor, I have children, then you need to ask, how old is your child? Is your husband aggressive towards your child as well? And then ask about husband's behavior. Ask about husband's behavior. Does your husband drink alcohol? How does he behave when he's drunk? Does he use recreational drugs as well? Do you know if he has been in trouble with the law? Okay, at any time? And then you need to ask about the child. If she mentioned that, yes, doctor, I have a daughter at home, and you need to ask about Lucy, who is her child, or it's just a name, so that you should know that, yes, they have children at home. So is your husband aggressive towards Lucy? Does your husband abuse you in front of Lucy? Okay, and then ask about her fears. In terms of finances, do you have your own finances, or are you dependent on your husband? Who owns the house you live in? Because a woman might be afraid that her husband might leave her, and she might not have anywhere to go. So that's the reason she might not be leaving, or she might not be thinking to leave her husband. Okay, so you need to ask those things. And then it seems that it seems that you have been going through a lot. Have you ever thought of leaving your husband? Okay, if the patient says that she has thought of leaving her husband, ask her, is there anything that stops you from doing so? Why are you not leaving him? Is there anything in particular that stops you? She might say that, doctor, my child, it would ruin my child's life. Now I have nowhere to go. I don't have any family. So you need to ask about those concerns. And then you need to ask, where are your parents? Are they around? And if you were to go home, or if you were to leave your husband, where would you like to go? Okay. Do you have any relatives, any friends? Where would you like to go? And then you need to explain, offer explanations, and with empathy. Okay. You should say that, I'm sorry to hear what you are going through. What you are going through is called domestic violence, and it is something that is not okay. And police deals with domestic violence over time. It's a criminal offense. I do not think you deserve what has been happening with you. Okay. And then you have to discuss the plan, that, okay, let me tell you how we can help you. There are certain organizations that can help, that can offer you help. We do offer contacts to such organizations like Asian Women Refugee Council, or Police Domestic Violence Unit, or Women's Aid National Helpline. You must memorize those organizations, because it is a part of the management. You have to refer the patient to, you have to give details, you have to give context of those organizations. Okay. And the patient might thank you that, okay, doctor, thank you so much, you've been really helpful. And then you need to discuss about the social services, that, okay, social services is for her child, because for Lucy, because they have got a child at home. And you need to inform whenever child abuse is uh, suspected, or there is a suspicion of child abuse. So there are certain concerns regarding child safeguarding. So then you need to offer social services and talk to her that, okay, Mrs. Sandra, because there is violence going on at home, there is a risk that Lucy may be affected emotionally or psychologically. So I know you told me that your husband is not aggressive towards Lucy, but just witnessing what is happening can affect her. And I'm afraid, or I'm concerned, that your child may be affected, and we will need to refer you to a different department for further assessment of your home environment, to assess how safe is this environment for Lucy. Okay. And then they may assist with where to stay and other financial issues. We can definitely offer you leaflets with information about these organizations. Is there something you would be, is it something you would be interested in? If you need any help today, they can help you as well. Okay. And what would you like to do? And then offer her an emergency plan. Okay. Ask her to have an emergency plan in case if the consequences, or if sometime the discussions or those clashes become grave, things come to such an extent that she has to leave her husband. So what she needs to do is, she should have uh, you would be telling her that, what I can advise you to make sure that keep your important documents like your passport, any financial or legal documents in safe place, so that if you were to leave in an emergency, you should not leave any of these important documents behind you. And if you were at home and things have become too aggressive, you can always call the police. Okay. And because domestic violence is a criminal offense, so there is help available for you. They are just one call away from you. And is there anything else I can help you with? We would not do these ourselves, as we are medical professionals, but we need to refer you your case to social services. Okay. And social, she might be afraid again that, doctor, social services might take my child away. And then you have to go through all those things. You have to tell that, okay, it's not always the case. And they initially, what they do is, they would come assess your home environment, and they will talk to your husband, they will talk to you. And after that, if they think that the child's your home is not a safe place for the child to live, and then they might consider taking away your child. Okay, they would be initially just assessing your child, assessing your home condition, and then you have to tell her that okay, we are medical professionals and we have some obligations, so we cannot directly send you, we cannot directly inform those organizations. What you need to do is you have to inform them, and we can refer you to those organizations. Okay, is there anything else that I can do for you? And what you need to do is, you have discussed the emergency plans. Emergency plan is to keep the documents safe. She should have her passport, her legal documents, and contacts of the person who she trusts the most, her family contacts or her friends contact. Okay, she should have a place which she should go after leaving her husband, right? So she should be keeping all those things ready. So this is all about domestic abuse. And I think we have another scenario, similar scenario. Okay. And this is very much similar scenario, domestic abuse. FY2 in the GP practice. Patient is 32 years old, female, presented with sleeping problems. Take a focused history, discuss management, and address her concerns. So it is very much similar. Here the patient has got sleeping problems, so you have to take history about medical history. You will be getting an idea from it, from the body language of the patient. The patient might be fidgeting, she might be anxious, or she might not maintain eye contact with you. And also there's a tip over here that she is 32 years old female, she's a young female, and sleeping problems, most of the times sleeping problems occur in elderly. Okay, and here she is a young patient, and young patients normally do not have sleeping problems. So here's a clue that okay, it could be this scenario. So you need to dig out the information from the patient, because and the patient might, let me tell you a short history about this patient, that this patient has been having some sleeping problems because her husband is having some trouble at work, and he is being abusive, and he is abusing her verbally. So that a few days ago he grabbed her hand, and also grabbed her hair as well, and then he punched her at one point. So she is disturbed, and she is here for help today, and she has trouble sleeping. So this is the background. So you have to dig out, you have to take all that history, start how to approach. You will be starting with the doing the after grips. Be positive. Okay, tell her that okay, I'm sure I can help you with that. And she would be telling doctor, I have some sleeping problem. You should ask that okay, I'm sure I can help you with that, but could you please elaborate, what do you mean by you have some sleeping problems? When did it start? When did it start? And could you please tell me, is it problem, do you have problem going to sleep, or the problem maintaining sleep? Okay, so you can ask this important question over here. How many hours do you sleep continuously? Is your sleeping environment fine? Is your room comfortable? Are you surrounded by noisy environment? And what time do you sleep? Do you take any alcohol before going to bed? Do you take any exercise? You need to rule out all those things. You have to take history. And then what time you go to bed, what time you normally get up, and how long does it take you to fall asleep, and ask for anything, any significant thing that has happened in the past few weeks. And then she might be nervous, and if you see it that she is nervous, then see it, say it, that okay, I can see that you look a bit uncomfortable and anxious. Is everything okay? And then ask that who do you live with? She would just reply that doctor, my husband. And then she might not maintain eye contact. She would just say that doctor, my husband. And then you would be asking, is everything okay with him? Offer confidentiality over here, and tell her that, can you please tell me more about what is happening with you and your husband? And she would tell you, the doctor, he's shouting at me. And the doctor would ask that, okay, what do you think makes him shout at you? Has he always been like this? You mentioned that she would tell you that, doctor, he is stressed at work these days, and that's why he's shouting at me. So you need to ask, has he always been like this? And has he uh, stressed out at, you mentioned that he's stressed out at work. What happened at work? You need to explore it, okay? And has he ever been physically aggressive towards you? Does he ever hit you or beat you? Has he ever abused you sexually? Has he tried to put you down, saying things to make you feel low? Okay. Since how long has this been happening? Would you say that it is getting worse? Has he been aggressive in the past as well? How was your relationship before everything started? Does he drink alcohol? What about any recreational drugs? Yes, you mentioned about the stress. He is under stress. So, any other psychological problem or any mental health problems? How long have you been married for? Do you have any children? You need to ask about that because you need to rule out for any child abuse as well. And then uh, you need to ask that, okay, what have you done so far about it? And then, have you ever tried to speak to your husband? Do you have any relatives, any family member close by? Have you ever discussed with any of your friends or your family? If not, why haven't you discussed it? What is it that has stopped you from discussing it with your family members or your relatives? Okay. And then you need to ask that about her fears, that do you have any joint commitments like housing loans, mortgage? What is the most important thing for you? Mm, Generally, what do you think could help sort out this problem? All right. So you have to ask all those questions, and then you would be using Eve protocol, that okay, unfortunately there are a number of women like you in this country, and this is considered as domestic abuse. It is a criminal offense and it is not okay. So you need to offer those organization, Asian Women Refugee Council, Police Domestic Violence Unit, okay, and Women's Aid, a national helpline. You have to offer those, and tell her about the emergency plan as well. If the husband has been really aggressive or all those things, and tell her because she is having some trouble sleeping as well. So you have to manage her medically as well. You have to give her sleeping pills. You can refer her for counseling therapy as well, and you have to uh, have a follow up with this with this patient after 2 weeks after she has taken the sleeping pills. Okay.
वो बहुत
And
ज्यादा
then
हो
and then what you need to do is, okay, then uh, let's move on to the next scenario. This is an elderly abuse scenario of elderly abuse. So let's see another scenario, and after that I will be taking questions from your side. Your FY2 in acute medical unit. Patient is an 80 years old lady who has been brought to the hospital by her daughter following a fall. The nurse has examined her and found her to have bruises of different ages on her arm. She has got right-sided chest pain and she is in the radiology department at the moment undergoing chest X-ray. Take a focus history, discuss initial management with the daughter. Special note is permission has been taken from the patient. Okay, so how would you start this station? This is basically, let me tell you some background history that there's a daughter who has been taking care of her elderly mother, and she has been sometimes rude to her mother, and she has been uh, pulling and pushing her, and this has caused her different kind of injuries on her body. So today, this morning, she pulled her and she pushed her, and then she got injury over the chest, and she developed right-sided chest pain, so she brought her to the hospital. And then now you are here to find out any reason for abuse or any reason for this pain, or you are basically you need to find out the reason for different bruises on her arm, because that could be an indication of all new and previous injuries and healed injuries. So how would you approach this station? You would start with grips. After confirming the relationship, you need to paraphrase that I understand your mom was brought to the hospital following a fall. I've been asked to come and talk to you and ask some questions in order to find out what has caused her falls. Okay. And then uh, you need to take fall history, that when did this happen, where were you, did you witness the fall yourself, did she trip on something, was there an accident, what was she doing when she fell down, who else was at home, was there anyone who witnessed this fall, did she hit her head into anything, did she lose her consciousness, has this happened before? You need to ask all those questions. Okay. And after that, what you need to do is the patient might say that no doctor, this hasn't happened. She might negate everything, that no doctor, she might refuse. And then you need to ask that do you have any idea what made her fall? And then you need to take social history of the mother, about living place, mobility, independence, that okay, what sort of things she needs, and what do you do for a living. You need to ask daughter as well, because sometimes it is very difficult for a person to take care of their loved ones or their relatives, as they are doing other jobs as well, they are if they are struggling with financial issues, so it becomes difficult. Then you need to ask her history as well. Okay, what do you do for a living? Are you the only carer of your mom? Do you get any help in looking after your mom? And have social services offered you any help? Who else is at home? Is there anyone else who helps you to look after your mom? Any other responsibilities of the daughter apart from looking after her mom? And how is she coping up in terms of looking after her mom? And do you think you need some help? And if we offer some help, such as arranging some carers, would that be okay in future? So you need to ask all those things. And then you need to take medication history of mother, allergies, and past medical admissions, any hospitalizations. And you just need to quickly go through a systemic review. And then you have to signpost into elderly abuse like you did in child abuse in the first scenario. So you need to say that I need to ask you more questions just to help me understand what happened at home. Is that okay? We usually ask these questions in every situation where an elderly patient presents with injuries. So you need to ask. We noticed that your mom has got different type of bruises over her arm. Some of the bruises look old, some are new. Do you know if your mom could have fallen in the past? Do you have any idea how she could have sustained these bruises? And who stays with your mom when you are away? I see that you have a lot of responsibilities, and do you sometimes feel that it is too much to handle alone? Okay. And then you need to tell, if she's not opening up, she's not telling, then you can say that sometimes carers in your situation get frustrated, they get exhausted with everything, and they become frustrated, and they can act out of the way. Okay. And they, such as they start hitting or beating someone they are looking after. So has such a thing ever happened to you? Have you ever gotten frustrated with your mom? Has this been the case with you? You need to ask those things. And then the patient might tell you here that, doctor, I malhandled my mom. And then you have to ask that, can you please tell me what happened? So she would be saying, doctor, I pushed my mom and she fell down on radiator. And you should ask that, when did this happen before as well? Was it the first time? And then did it happen in the past? Was she brought to the hospital in the past? And how long has this been going on? How many times in the year would you say that this has happened? Apart from this, uh, have you ever done anything else to her, such as neglecting her care, not giving her food or shower, shouting at her? Has such a thing happened in the past? You need to ask for that. And then you need to sympathize, that I'm really sorry to hear what you and your mom are going through. Your mom is going through x-rays for the chest pain, so she will be given painkillers. We will scan her body to see if she has got any fractures anywhere. Unfortunately, because there have been some rough times between you and your mom, unfortunately this is regarded as an abuse, and it may influence what we do in terms of moving forward. In such situations, we are required to refer your mom for further assessment. So we will need to refer her to social services. And we will also speak to your mom, and then she might say that, doctor, do not involve social services and they will take away my mom. And then you have to do it, that uh, they will, after completing their assessment, after once they have assessed, and after they have assessed your mom, what they will do is they will talk to your mom. And if they feel that your mom is safe at home, they will let your mom stay at home. But if they find that there are some concerns, so they will bring this discussion with you, and in the worst case scenario, they might take your mom away. Okay, and you have to inform the seniors as well. Always inform your senior in all the scenarios. Okay, it is good to take help from the seniors. uh, Even if you are not sure about anything, you can ask in practical, in real life as well. You need to ask from seniors. It is better to ask your seniors, inform your seniors, instead of doing something wrong. Ask your seniors. Senior help is always appreciated. Okay, so you need to inform your seniors. And okay, so any questions so far? So to begin with, we are having this scenario of postmortem. You are an FY2 in acute medical ward, Mr. Adam Jones, a 65-year-old man who was admitted 4 days ago with shortness of breath. Unfortunately, patient died yesterday. The cause of death has been found to be acute respiratory failure, secondary to chest infection. Death certificate can be issued with a diagnosis of acute respiratory failure, but has not yet been issued. Talk to his wife, Miss Elena Johns, and address her concerns. Okay, basically, wife is here and she has got some concerns. She would like to order for post-mortem, because when you ask her that why is she wanting to order for post-mortem, she might tell you the reason. The doctor, one of my nephew or one of my cousins, he is a nurse, so he asked me to go for post-mortem. Okay, that's why she has come here today, to order for post-mortem. And questions are, will a post-mortem delay the funeral? So the answer to this question would be no, it won't. But it would be decided by the team who are going to conduct this post-mortem. Okay, and then will you disfigure his body? The answer again is no. We are not going to disfigure. It won't disfigure his body. We are going to close his body, or the person, the pathologist who is going to perform this post-mortem examination, he will nicely close his body after taking his parts for examination. Will it delay issuing the death certificate? So the answer to this question again is no. All right, so let's go through it. How to approach it. So you need to approach it with grips, but remember that it is not a smiling station. Okay, just go with a normal facial expression, no smiling face, because her husband has died and you cannot smile. You just be natural, uh, should have your normal facial expressions. You need to confirm the relationship. Okay. How are you related to? Hello, I'm Dr. Amma, one of the doctors working in this department. May I confirm your details? And okay, how are you related to Mr. Adam Jones? Okay, she would say, I'm his wife. And then you would be asking that, okay, what have you been told so far about your husband's condition? She would say, that, yes, doctor, I know he died last night. And then you have to show some sympathy, and you will be saying that, I'm really sorry to hear about your loss. Please accept our condolences. And how are you coping how are you coping up at this difficult situation or at this difficult moment? Okay. So this is a part of your IPS. And she will say, Yeah, doctor, okay, doctor, it's fine. I'm doing fine." And then you would state the purpose, that, okay, I understand you wanted to speak to one of the doctors. So please go on, tell me, what is it that you would like to speak? Is there anything in particular you would like to speak or talk about your husband's condition? She would say, yes, doctor, I want to order for a postmortem. I want postmortem. And then you need to ask that, okay, why are you considering postmortem? She would say, doctor, it is because my family wants, or my nephew has asked me to go for it. And then you need to explore any concerns. You need to ask that, okay, do you have any concerns about the treatment given to your husband at the hospital? Okay. And did anybody explain to you that what happened to your husband, what led to his death? And then if it has not been explained, then you need to explain it now. And you would just say that, okay, as you know that your husband came in with chest infection 4 days ago, and unfortunately from the chest infection he developed respiratory problem, and this is what unfortunately he died from. And then then you need to ask that, is there any particular reason you feel that a postmortem is needed? So she has already told you that, doctor, my nephew, he works in another hospital and he has told me to go for uh, postmortem. And then you need to ask that, okay, let me check. Can I just ask you that, what is your understanding about postmortem? And do you know how it is done, and who does it, and why it is done? What are the reasons for doing it? You need to ask those questions. Okay. And then you need to take a brief medical history, and then you need to ask about, okay, did he have any medical problems apart from this condition? Was he on any medication? And after you have checked the post understanding of the patient or the relative about postmortem, then you need to explain. You need to tell that, okay, let me explain it to you, that first thing, I would like to tell you that, why do we offer, or when is a postmortem indicated? Okay, there are certain situations where we offer postmortem. And this is that sometimes hospitals do it spontaneously without your request. But there are certain reasons for doing it. Number one being that if we are not clear about someone's cause of death. Number two, if someone was admitted and died within 24 hours of hospital admission. Number three, when any criminal activity or foul play is suspected, and we offer this postmortem. But in your husband's situation, we didn't have any of these. So because we have the clear cause of his death, so we do not have any doubts about his cause of death. That's why we think that postmortem would not be necessary at the moment. And if you can tell her that, if you request for postmortem, because it's the relative's right, despite your advice, if she wants to order for a postmortem, you can offer her. Okay, you can say that, okay, if you request for postmortem, I can offer you a corner. They are the legal part of the hospital. Okay, you can. And then You can tell, now let me explain it to you that what happens in the procedure. Okay, what is a postmortem? Basically, it is a detailed examination carried out by pathologist in a laboratory, which is very much similar to an operating room. And it begins as external examination, and then it proceeds to internal inspection and examination. Firstly, they will make large cuts on the body, and then they will open the body, and they might consider taking out some of the organs or a part of that organ for examination. Okay, and then they will be performing some tests, or they will be testing those organs for any uh, suspicion of poisoning or any other suspicious activity. Okay, and then tell her that there are two types of postmortem. One is full detail examination, in which all the main organs, all the organs of the body are inspected, and pieces are taken out from them, or either whole organs are taken for examination. And the other is limited postmortem study, in which only certain organs are, only a few targeted organs are examined. For example, in your husband's case, he died of respiratory failure, so main focus of examination would be the lungs and heart. Okay, so this would be examination. And then after they have taken a look at this organ, or those organs which were taken from the body, they will replace those organs in the body. Okay, and then they will nicely close the body, and after it will be returned to the body, and they will nicely close the body. And she might say, doctor, I have heard that they disfigure the body, because I have seen it in the movies, that they disfigure, they chop the bodies. So you need to tell that no, it is not something that you might have seen in the movies. It is because we need to maintain the patient's dignity. That's why we will be closing his body. The surgeon or the pathologist, he would be closing the body nicely, and we won't disfigure his body. Okay, and all the cuts would be repaired or sutured with care and nicely, and they won't be visible. And as she asked that, okay, doctor, will it delay the funeral? Then you will ask them, you will tell them that, okay, have you decided the date of funeral, or are you deciding for burial or cremation? Because there are certain religions in which they go for cremation. Okay, they do not bury the body, and in some religion they bury the body. So the answer to this question would be no, there should be no delay to the funeral. Okay, uh, and she would say, how long can it take, the postmortem could take? So you can say that it could take either days or weeks, depending on how busy our postmortem team is, that is the pathologists are, but it shouldn't delay the death certificate. We know the cause of death, so we can offer you, we can provide you with the death certificate. And then you need to offer bereavement services by asking that, okay, have you been offered bereavement services? Do you need any help with funeral services? Okay, offer bereavement services and funeral services. Okay, and then mm, you have the patient might you and the patient might come to an agreement that, okay, doctor, I do not want a postmortem, or whether she still wants to go for postmortem, then you can refer her to coroner, who are the legal part of the hospital. Okay, this is all about postmortem. Okay, we have another scenario where you are FY2 in GP. Elizabeth Black is a 20 years old lady who has come to your GP practice with some concerns. Patient had come to your GP practice 2 days ago with sneezing, cough, sore throat, and blocked nose. The nurse performed a nose and throat swab, which came back negative. She was advised to take paracetamol and use steam inhalation. Please talk to the patient and address her concerns. It could be, yes, or it could be a male patient who has to go or who has to go some other social gatherings, or someone. It could be any of those scenarios. Okay, so there are two scenarios where there is a female, or it could be a male patient. Okay, so how you approach the station? You start with the grips. You need to paraphrase only if it is a follow-up appointment, because it is a follow-up appointment. So you can start by paraphrasing this. Okay. You can ask that, okay, I understand you visited 4 days ago. Then ask the 4 questions of follow-up in every scenario. That, okay, what symptoms did you have? Okay. What investigations were done? What did they tell you about your diagnosis, or what was wrong with you? What did they tell you about it? And what treatment did they give you? What treatment did you receive? Okay, always ask those 4 questions as follow-up questions. And then if it is the person presenting to you for the first time, you haven't seen them before, then you can say that, okay, how can I help you? Patient says that, doctor, I need antibiotics. So you will be asking that, could you please tell me why do you need them? Can you please tell me what sort of symptoms did you have? And then you have to check for all the symptoms of upper right respiratory tract infections. Okay. And you have to check for bacterial infection as well. Like there would be, in case of bacterial infection, there could be high fever, sore throat, pus in the throat, runny nose, cough, fever. So these are signs of whenever there is pus, or there is high grade fever. So you can make a suspicion of bacterial infection. That's why this swab has also been taken. And then you need to take, basically you are going to take history of the presenting complaints. Is a counseling, medicine counseling, so that's why you have to take a bit of history, but it is different from that history taking scenario. So you will be asking, ruling out symptoms, signs and symptoms of meningitis, like photophobia, headache, neck pain. Okay. And you need to rule out with fever, cough. You need to rule out for pneumonia, fever, cough, chest pain. And you need to rule out for any ear infection, any hearing problem, and sinusitis. Okay. So these could be your DDs. Ask for headache, morning headache, or pain on face, okay, or cheekbones. And then you have to quickly go through systemic review, that is PMMA, HO family, and DESA, RS Toli. You have to go through all that systemic review, and then go for AICE. That is, you need to ask for anything else you would like to tell me, or is there anything we haven't discussed so far? Do you have an idea what could be the cause of your symptoms? Do you have anything in particular that worries you the most? Do you have any particular concerns? Okay. What is the most concerning thing for you at the moment? And then what you would do is you have to examine the patient here. Examination is very important. Basically, it is a counseling station, but you have to examine. It's a medicine counseling station. You have to examine the patient. You will be taking the general observation of the patient, and you have to check for this ENT. You have to go for ENT examination, chest examination. Okay. And then you have to tell the patient that everything is normal. After examining the patient, the examiner might tell you that everything is normal. And then after explaining the examination to the patient, examination findings, tell the patient that, okay, as you already know that we took a swab from your throat, and it came back as negative, which means that you do not have any bacterial infection at the moment. That means you are free of bacterial infection. So you could have, and then you need to explain, patient might say, doctor, what is the cause of my symptoms? Then what has caused these symptoms? I've been going through all this, and runny nose, and it's been bothering me for quite long. And what is the reason for it? And you have to explain that the reason for your symptoms is an upper respiratory tract infection, or in simple words, it is called as simple flu, which is caused by a viral infection. And then you should reassure him that you should be okay in a couple of days, because the viral infection, in the normal course of viral infection, is that it usually starts. When it starts, it progresses or becomes worse in the initial 2 to 3 days, and then it remains at the peak, or this similar situation persists for next 2 to 3 days, and the following 2 to 3 days it will resolve on its own. You just have to take this symptomatic treatment. You just have to take treatment for your symptoms. Okay. and you have to continue, advise him to continue with the paracetamol and steam inhalations, and ask them to drink plenty of fluids so that they do not become dehydrated. And you can offer them Lemsip, which is a local remedy for flu. Okay, and you can follow up in 1 week's time if they feel the same, or you can follow up to see how they are doing. And basically, this patient, the main concern is that patient is here for antibiotics. So he will say, no, doctor, I want antibiotics. So you will tell that normally we do not give antibiotics it is not a practice to give antibiotics in viral infection. There are reasons for it. Number one, that antibiotics have no role in viral infection. And other reason being is that you may develop side effects of antibiotic treatment. If you take another thing is that if you take antibiotic more frequently and unnecessarily, you may develop antibiotic resistance, which means that your body might not respond to antibiotic treatment when they are actually needed. Okay, and antibiotics may stop working for you in that case. So for this reason, we do not give antibiotics. And he will be asking, doctor, can it become a bacterial infection? And you have to say, unfortunately, yes, it can become a bacterial infection. And then patient would say that, doctor, how would I come to know that it's a bacterial infection? And you would tell signs or symptoms that, okay, your symptoms will be more severe, and you will be having high fever, sore throat, you will be feeling very unwell, and you might be having pus in the throat as well, which I discussed earlier. Okay, this was all about upper respiratory tract infection, because you have to counsel them, you have to give them a logical reason that why you are not going to give them antibiotics. So main reason for not giving antibiotics is that he is having viral infection. He does not need antibiotics because antibiotics have no role in viral infection. Secondly, he might develop any side effects unnecessarily taking those antibiotics. And another reason is that he may develop antibiotic resistance in long run. All right. So let's move on to the next scenario. Okay, the next scenario is food poisoning. So you are FY2 in GP. Patient is 35 years old lady, presented with abdominal pain and diarrhea. Patient developed these symptoms after eating in a restaurant. Talk to the patient and inform her that the disease is notifiable. Okay, so basically, she went to eat in a local restaurant 2 days ago, and she developed diarrhea and abdominal pain. And she went there with her husband and son as well. They ate the same. They ate the same food over there, and they also developed this same symptoms. And this restaurant belonged to her friend. Okay, and when you are going to tell her that doctor, that we need to notify this restaurant, so she will be a bit reluctant, that she will be refusing the doctor, I don't want to get them in trouble, it's my best friend's restaurant. And she might struggle, and she would be reluctant to say that, but at last she would give you the information of that you have to explain that it is our responsibility to prevent other public, general public, from such infection. Okay, so let's see how to approach. So approach will be, you will be doing normal grips, and you will be asking, how can I help you? Like it's a basic medical counseling station, so medical history will be taken over here. So you will be starting with the history of presenting complaints. Take history for diarrhea, that is STOOPPA. That's the acronym for it. That when they start suddenly or gradually, and has it become worse over time? Is there anything that makes it better? How many episodes do you have? Have you noticed any blood in it? Okay, do you have any fever along with it? You have to ask for all those things. And then ask for abdominal pain. You will be taking the pain history as well. That is STOOPPAKRS. You have to ask for where exactly is the pain, when did it start, did it start suddenly or gradually, has it changed since started, is there anything that makes it better, anything that makes it worse, has Could you please score it for me? What kind of pain is it? Okay. And how severe is your pain? And has this kind of pain occurred before? You need to ask all these things, and then you need to rule out uh, you need to take history about gastroenteritis, because you have to rule out it in DDs. Ask about vomiting, ask about bleeding in stool, okay, any bloody stools. And you need to rule out TDs as gastroenteritis, because gastroenteritis, if once gastroenteritis will be if the infection person gets infected once, the infection goes on, grows, and then develops symptoms in a day or two. Okay, normally this would be the history for gastroenteritis. And if it is food poisoning, symptoms start within an hour, meaning that symptoms start immediately after eating the food. And ask about when did they develop the symptoms, eating outside, who else was with them, and did they eat the same food, where did they eat, have they ever been to that place before? Okay. And then you have to rule out infectious bloody diarrhea, that is dysentery, or you have to rule out typhoid as well, mainly asking about travel history or swimming history or any history of hepatitis. And you need to ask about all those things. You have to rule out, basically you need to rule out gastroenteritis, food poisoning, and you have to rule out dysentery. So then you need to tell that this is after you have taken this history, the patient might tell you that they ate outside, and you have to tell that it is notifiable disease. And I, as a doctor, it's my obligation, professional duty, to inform the relevant authorities. Okay. So have you ever been to this place before? So she would say, yes, doctor, it's my best friend's restaurant, and I've been there 2, 3 times before, but this has never happened before. Then you would ask that, okay, I would like some details of that restaurant. What is the name of the restaurant? Where it is located? Do you know the address? Okay. And you have to ask all this. After you have completed your systemic review, you have taken the history, you have completed your systemic review with PMA, Holy Family, Tessatoli, TRSSS. You have completed that, and then you have to tell that, okay, I would like to examine you. After examination, you need to examine the patient, check observations, might be running temperature, and do abdominal examination and explain the diagnosis to the patient that, okay, you are likely, or having listened to you and after examination, it seems that you could have a condition called food poisoning. It is caused by eating or drinking food items which are contaminated by germs or toxins. Okay. And then you will be telling the management for the patient, and ask the patient to take plenty of fluids so that they don't become dehydrated, and wait for the toxins to get eliminated, and also take stool sample to be sent for examination, okay, to see which type of bug is causing that infection. And you need to safety net for this safety net for any symptom signs, that okay, if you generally feel unwell, or you see blood and diarrhea, you become lethargic, you are unable to do your daily activities, you need to come back. Okay, you need to safety net. And what you need to do here is you have to notify the restaurant. Main thing or important thing here is that you have to notify. So how would you notify? You would say that we have to notify this restaurant, or we have to notify such type of cases, because in the UK, if there is suspected food poisoning, the doctor is expected to notify or report to the local authorities in order to make sure that this will not spread to other people. And patient might tell you, the doctor, they will close the restaurant, and she might struggle, so I do not want to do this to my best friend. And you will tell that, okay, I understand your concern, but let me tell you that they will not always close the restaurant. It may not be their fault. Okay, there are different ways food can be contaminated. There may be storage problems, may be contaminated from where they get the food, or problems with cooking. So the infection control team will visit them and they will make sure that they get to the bottom of the problem and to see what caused this food poisoning. Okay, and also you need to advise her that you need to wash your hands after going to the washroom, after going to the loo. You have to wash your hands with soap and water, and avoid handling food items for 48 hours after your symptoms have cleared. Okay, after the last episode of the diarrhea, that you won't be handling any food items until your diarrhea has subsided and 48 hours have passed. Okay, so this is all about food poisoning. Next is celiac disease and endoscopy. So your FI2 in GP patient is a 55 years old lady who has come for follow-up. She has presented with tiredness and has some investigation done last week. Blood test, that is HB, is 9.8. Tissue transglutaminase antibodies are positive. Talk to the patient, explain the results, discuss further management. So she's having positive TTG antibodies. So it means that she's having celiac disease. So we need to refer her for endoscopy. We need to do further confirmation. So let's see what we can do for this woman. So basically, it is a history taking scenario. What you will do is you will be taking history, medical history, and you will be, it's a follow-up scenario. So you will be paraphrasing. Start with grips, then paraphrase that I understand you were here, or you are here for follow-up. I also understand that you had some blood tests done. Did anybody explain the reason why these tests were done? What were they looking for when they ordered those tests? And uh, did anybody explain the results to you? And then signpost that I have got the results with me. I have the blood test results with me. I would like to ask you some questions to have a better understanding about your health before I discuss the results with you. Is that okay with you? And then start taking the history. That could you please tell me what kind of symptoms did you have when you visited the GP, or when you first presented to the hospital or your practitioner? And what kind of test did they do? What did they tell you about your condition? So you need to check prior understanding and then take the history of tiredness. You would say, doctor, I was feeling tired for the last 2 months. Then you will be checking, you will be taking history of tiredness. That is, when did it start? Did it start suddenly or gradually? Has it been, has it improved over time, or has it been becoming worse with the passage of time? Okay, what have you done so far for it? And is there anything that makes it better? Anything that makes it worse? Okay, any other symptom associated with it? And then you need to ask for any particular symptoms, any symptoms that are associated with celiac disease. For example, abdominal bloating, tummy pain, diarrhea, constipation, weight loss. You have to ask for those symptoms, and then check for complications by asking that, okay, do you have any lightheadedness? Because there is anemia given in the scenario. HB is 9.8, patient is anemic. So you have to ask for anemia symptoms as well. That, okay, do you feel any lightheadedness, any heart racing, any shortness of breath? Okay, and then go for systemic review. Ask PMA, Holy Family, DESA, Arestoli, and then here you do not need any examinations because you have already got the results with you. No need to mention the examinations as well. Okay, so you have to explain the results that, okay, so I have got the results with me. The first thing that I would like to discuss is with about your blood levels, that your test state that you are having low blood levels, which means that you are anemic. We also did a marker called tissue transglutaminase antibodies, which came back positive, which is a type of antibody which we hope to see in a type of disease called celiac disease. So these tests are suggestive of a condition called celiac disease. Do you have any idea about celiac disease, or have you heard of it, or have you heard of celiac disease? Okay, and she would say, yes, doctor, I have heard about it, but I do not know what it is. And then you have to explain that, okay, It's a condition in which there is some inflammation of the bowel as a reaction to a substance called gluten, which is a protein found in some foods, okay, such as rye, barley, wheat. It is an autoimmune condition, meaning that the reason for this is not known, and our because the reason for being it is an autoimmune is that autoimmune means that our body our body's defense system recognizes these particles, these food particles or these proteins as foreign materials, and that's why they develop immunity, they develop defense against this food particle, and they destroy the normal tissues as well. Okay, so then you need to check for understanding that after you have checked it, you can ask, okay, could you please tell me what do you understand so far we have discussed? She would tell you, yes, doctor, I've got celiac disease is because of a protein in food, and it is autoimmune, means that body's defense has become defective and it is destroying cells in my tummy or in my bowel. So then you need to move further. You need to tell that, okay, we need to confirm it because we are suspecting this diagnosis. Your tests are suggestive of this disease, but we need to confirm it. So we need to order for a test called endoscopy. Do you know what an endoscopy is? Have you heard of it before? She might say, no, doctor. Then you need to explain about endoscopy. In a similar way, you can explain colonoscopy or cystoscopy. Okay. You need to say that, okay, it is a camera tube test in which we will be using a thin, flexible tube having camera and light source at one end. And it is flexible tube, which is the size of your little finger, and this will allow us, we will be passing this camera tube into your stomach through your mouth into your food pipe and then stomach and then into your bowel, small bowel, to take samples to see inside of your tummy, inside of your bowel, and also it allows us to take samples for further examinations. Okay, but before that, what we will be doing is we will be giving you a numbing agent. We will spray some numbing agent in your throat, or we will be giving you some numbing agent to drink. Okay, so that you won't feel any pain. The procedure would be a bit uncomfortable, but it would be not painful. It won't be painful. Okay, and then patient might ask you that, doctor, how long is it going to take for this test? So you will say that it hardly takes around 15 to 30 minutes at max. And then you need to check understanding that do you understand about this? She would say, yes, doctor. And you have to tell that patient might say, doctor, when are you going to perform this? You have to tell that, okay, we need to at least 6 weeks from now. Okay, because you during this time, what you need to do is you have to take more gluten in your diet. More gluten means that the food that contains gluten, for example, pastries, wheat, rye, barley, and all those things which contain gluten. So because we are planning to see the inflammation which occurs in celiac disease, so that's the reason we want you to incorporate more gluten in your diet. So that's the reason you are advised. Patient might ask you, the doctor, if I'm having gluten allergy, why are you advising me? Then you have to tell that, okay, we want to see that inflammation. We are hoping to see this at the test. So that's why you are advised to take this gluten-rich foods, okay? And we will be doing this test at least 6 weeks after from today's visit, after 6 weeks, okay? And once we are done with the biopsy report says that if you've got celiac disease, then we will be putting you on gluten-free diet lifelong, okay? And this is the treatment for this condition, okay? And we can also refer you to gastroenterology department. And also what you can do is you can advise her that she should bring her siblings, or she should talk to her siblings for testing for this condition, because it's autoimmune, so it can happen in their sibling as well. So the next scenario is worried about meningitis. So you are FY2 in GP surgery. A 30 years old lady presented with some concerns. Talk to the patient and address her concerns. Basically, she is a lady who has come to you being concerned about meningitis because her nephew had meningitis and 2 months ago, and she had not seen 2 months or 2 weeks ago, and then she has not seen her nephew for the last 2 months. Means she has not been in contact with him, but still she is worried that she might get meningitis. So she might have read it somewhere on social media that meningitis is a communicable disease. So it happens, it occurs. So she is worried. So she has come to discuss it with you. Okay. So let's see how we approach. When you start, you will be starting normal grips. So you ask that, okay, how can I help you today? She would say, doctor, I need antibiotics because I need antibiotics. She would, you need to ask, why do you need, can you please explain it to me why you need antibiotics? Or can I ask you a few questions to see that why do you need antibiotics? Then you can tell. Okay, she would say, yes, doctor, I'm worried about meningitis. And you would say that, is there anything in particular why you are worried, or anything that makes you worried about meningitis? She would say, yes, doctor, my nephew has been diagnosed with meningitis. So you need to say that I would like to ask you a few more questions to have a better understanding about your condition and decide whether antibiotic is the right thing for you or not, or whether you need the antibiotic or not. Okay. And then you will be asking about that nephew's history. That, okay, can you tell me when did your nephew develop meningitis? Where is he now? Is he in the hospital? How did you come to know that he has meningitis? She would say, doctors told me and the nurses told her and whatever. And then, have you been in contact with him since he became unwell or since he developed meningitis? Do you live in the same house? When did you last come in contact with him? What makes you feel that you could have contracted meningitis from him? Is anyone unwell at your home? Have you been in contact with someone else who has had meningitis? And do you have any symptoms at all? And then you need to ask for any symptoms of meningitis, for example, any rash, any neck stiffness, any headache, any shyness to light, okay? And then any fever. So then go for systemic review with the PMA, Holy Family, DESAR, RS, TOLI, okay? And ask about her, particularly about past medical history, okay? Has she ever had meningitis in the past? And has she been vaccinated, or has she received any vaccine for meningitis in the past, or childhood vaccinations? And what about any travel history? What about any travel recently? Social history, including vaccination against meningitis, which type of vaccine if she has had, and then childhood vaccination such as measles, mumps, and rubella vaccination. Okay. Normally, we do not ask about vaccination in adults, but this is the scenario where you will be asking about vaccination. Okay. And then go for examinations, check observations, go for neurological examinations, and check for any lymph nodes in the neck. Okay. And any nodes in the face or neck. And then examiner would tell you that all the examination is normal. And then let me tell you that incubation period of meningitis is normally 2 to 10 days. So you have to explain this to the patient as well, okay? That it is highly unlikely, as I have examined you, everything seems normal. It is highly unlikely that you could have contracted meningitis because you have not been in contact with your nephew for a long time. If someone has meningitis infection, they will develop symptoms within 2 to 10 days. This is the period which we call as incubation period, during which somebody develops infection. Okay, since it has been 2 months you last saw him, so it is highly unlikely that you could get this infection. And tell her that meningitis is an airborne infection, and one can get it if they have close contact with someone having meningitis. But in your situation, you don't need prophylaxis of antibiotics as well. And you need to talk about vaccination. Tell She would be saying that, yes doctor, I had vaccination and all those things, and then you need to mention that, okay, you mentioned about your vaccination, that you are vaccinated against meningitis, and so that will give you protection up to 5 years. There are different types of meningitis vaccines. Okay, and then ask her to talk to the occupational therapist or occupational department, and get vaccinated against other forms of meningitis infections. Okay, this is about meningitis. So we have another scenario, that is heart failure. This is the first presentation with shortness of breath. So you are FY2 in GP. Patient is a 65 years old male, presented with shortness of breath. Assess and discuss management with patient. So it's the patient has come to you, and it's first presentation, and he has been having shortness of breath for the last 3 months, on and off, and it worsened over time, particularly when he went for exercise or a walk, and it relieved with rest. And he has a family history that his mother had heart failure. Okay, and he used to play tennis, and now he is unable to go for tennis as well because of those symptoms. So he has come to you. So what you will be doing is you will be taking history of shortness of breath. That when did it start? Is suddenly or gradually? What time do you normally get it? And what are the symptoms you get apart from shortness of breath? Is there anything that makes it better? Anything that makes it worse? Okay. And what have you done so far to help yourself? And then rule out DDs such as heart problems. Ask about any heart issues, for example, heart attack, any leg swellings, any chest pain, any disease spells, any rule out asthma and cough. Ask about cough, wheezing, ask about anemia symptoms, that is lightheadedness, ask about CA symptoms because patient is 65 years old, and shortness of breath could be a sign or of anemia. It could be a symptom of anemia. Okay, so you need to ask about CA, that any weight loss, any night sweat, any loss of appetite, okay, any fever. So you can ask about it. And then pneumonia, because mycoplasma pneumonia can run for 3 to 4 months. It can also cause pneumonia, can also cause shortness of breath or difficulty in breathing. Ask about any swelling, go for systemic review. Do your PMA, Holy Family, Desarestoli, and then go for AIC. Anything else you would like to tell me? So far, we haven't discussed anything that you would like to tell me. Or do you have any idea what could be the cause? Anything that worries you the most? Do you have any particular concern? You have to ask, okay? And then ask for effects of the symptoms as well. That, okay, how has this affected you? Would you say that this has affected your daily activity? He would say, doctor, I am unable to go to play tennis. Before I used to go and play tennis, but now I cannot. So then go for examinations, check observations, taking blood pressure, pulse, temperature, oxygen, and breathing, and doing chest examination, lungs, listening to lungs and heart. Okay, and examine the legs. Examiner might not give you any findings on those examinations. Okay, and then you need to explain it to the patient that I suspect from what you have told me, then what you are suspecting, you can give provisional diagnosis of heart failure, and then you need to tell the patient that we need to run some tests to confirm it. So you would say that you just mentioned that I would like to go for chest X-ray, blood test, routine blood test, and echo of your heart tracing and echo of your heart. And then examiner, when you mention X-ray, examiner might hand over you an X-ray and then you will be pretend to look at the X-ray and check for there might be venous dilatations, because you might see hyperdensities, hypodense areas, okay, and you might see effusions which are hyperdense. You have to look for costophrenic angles, okay, and water will be there. So you can water buildup might be there. So it is uh, pleural effusion secondary to heart failure, because water when back pressure rises, so it goes back into when the heart pressure or resistance rises due to the back pressure, it water accumulates within the lungs. So you will tell the patient that I have had a look at your X-ray. There are some fluids in your lungs, which suggests you might be having heart failure. And what you need to do is you need to explain the patient that, okay, what is heart failure? You have to tell that when heart is unable to meet the requirements of the body, heart is not able to pump the blood needed by the body. So person develops a condition called heart failure due to inadequate uh, mm, cardiac activity, or due to other reasons as well. So uh, in this condition, heart is not able to meet the requirements of the body, and it cannot pump adequate blood to all organs of the body. So you are experiencing this shortness of breath. And then what you need to do is you need to refer the patient to the cardiology. Cardiologist will analyze the echo, ECG, and give you tablets. Mostly they will be giving you water pills. That is, we are talking about furosemide pills that will take out, or that will drain the water from your lungs. Okay. And they might consider giving you some other medications for heart failure, mostly beta blockers and cardioprotective beta blockers. Okay, and then you need to safety net the patient for symptoms that if your condition gets worse, you need to come back to the hospital. Okay, so this is all about heart failure. But let me tell you, you can start this scenario in another way as well. Somebody who's coming to you with shortness of breath. So scenario states that they presented with shortness of breath. So what you can do is to sound different and to show a different approach. What you can do, you go inside after greeting the patient. If you see there are signs of distress or whatever, the patient is unable to speak to you, unable to talk to you, the very first thing you need to do is that you will be saying that I would like to examine. I can see that you are short of breath, or you have some difficulty in breathing. I would like to check your observations, including your blood pressure, pulse, temperature, oxygen, and breathing. And then the examiner might give you some findings, and then you can see that, yes, I can see your oxygen saturation, oxygen in your blood is low, which is 90 or 89. So I would like to give you, or I would like to offer you oxygen. I would like to offer you oxygen. And then you start them, you pretend, or examiner might say that, okay, oxygen given. And then the patient might improve. Okay. So keep in mind those things. This is all about those medicine counseling scenarios. Now we are going to discuss about warfarin. So any questions? Okay, so let's begin warfarin treatment. Let me tell you that warfarin is a blood thinning agent, which is given to someone who has uh, risks of developing clots in legs or lungs. Okay, so we need to give them warfarin, oral warfarin tablets. Okay, it comes in oral form, so we have to give this warfarin tablets. There are different colors and different dosages of warfarin tablets. Okay, so let's start with the first scenario. You are an FY2 doctor in general medicine ward. Your next patient is Mr. Thomas Green, who is 56-year-old man, was admitted 4 days ago with swelling of his right calf. Please talk to the patient and address his concerns. So it means that it is somewhat suggestive of DVT. So he was admitted here, and he has got some questions, concerns about warfarin. So which test do I have to do? Will I be coming to the hospital? Will I be coming to do the blood test? What is the dose? How often will I need to get my INR checked? What time should I get the test done? Do I have to take the medication every day? How long do I have to take the medication? Can I take it with TV shows? Why should I take this medication on a particular time? So you have to address all those concerns. You have to answer all those questions. Okay, let's see how to approach this scenario. Okay. What you need to do is you will be approaching the station after doing grips. You need to check patient's understanding, that you need to ask about patient's general condition. Like, okay, I paraphrase it, that I understand that you have been admitted 4 days ago. You had some swelling of your legs. So could you please tell me, how are you doing now? What symptoms did you have when you came to the hospital? What investigation did you have? What diagnosis did they give you? What did they tell you about your condition, and what treatment did they provide you? Maybe the patient is having warfarin in his hand, okay, maybe holding, and he might not know how to take it. So you have to paraphrase, and then you have to explain that about the diagnosis, that okay, you have had DVT that is developing clots in the legs, okay, and explain about the treatment that you have been prescribed with a medication called warfarin, which is a blood thinning agent, which we normally prescribe to prevent the clot formation in the legs and lungs, okay. And then you will go on taking the history. It's basically it's counseling station, so you need to ask for any regular medications if the patient is taking, because there are certain medications with which warfarin interacts. So I could tell the patient that you will be needing a blood test called INR, which can be done either either by the GP or anticoagulation clinics, okay. So patient has a concern that will I be coming, or who will be doing the test? So you tell that a GP or either GP or anticoagulation clinics can do it for you, and we do this test called INR, which is to check how thick or how thin your blood is, okay. And tell the patient that you will be having this test in the morning and every day for 2 weeks, and we will be checking your INR, and you will be having this test in the morning, and the results will be conveyed to you in the afternoon, and any change being made to your dose will be done in the evening, okay. Results will be conveyed to you, and after that we will change your evening dose, and you have to take this medication every day at the same time in the evening. And the reason being that is we want you that there are certain medications, warfarin is one of them, that which need that we need certain amount of concentration of this drug in your body. So to maintain that concentration in the body, you need to take this medication at the same time every day, okay. And tell him that do not miss any dose, and in case if you miss a single dose, do not try to take double dose. Take your dose as soon as you remember it. Do not try to take double dose, okay. And explain the dose, how to take it, and use the BNF if there is BNF present in this scenario. So you can use BNF to check for dose. You can just pretend that, okay, let me look into the BNF, which dose would be appropriate for you. If he asks for dose, and you can tell in the BNF dose and duration, okay. And what you need to do is you have to take some history about medications, and ask about any other blood thinning agents, any other problems, any chronic illnesses, okay. So because we are going to discuss other scenarios, we will be facing these problems, that the patient needs warfarin, and he has been placed on either antibiotics, or either he is taking some other remedies such as cranberry juice. So they can change the concentration of warfarin in the blood, okay. So you have to give an important information over here, that about alcohol, that okay, you need to drink. Do you drink? And they would say yes, I do drink. And then you need to ask about drinking and tell them that you need to drink within the recommended limits, that is less than 14 units a week with at least 2 alcohol-free days. Okay, and you need to explain the side effects of the warfarin, that there could be some side effects including nasal bleed, bruising, vomiting, dark stool, blood in urine, heavy menstrual bleeding if it's a female, and you also need to inform your dentist before going for any procedure, any dental procedure. Okay, this is important information. And you can tell about the pregnancy, that if she's a female, you need to tell that, okay, warfarin can affect the development of the baby, so try to avoid any unplanned pregnancy. Inform your GP, because during the pregnancy medication will need to be changed, or dose can be changed, or it will be modified to another medication. Okay, and what else is that, tell them that head injury, in case they have head injury, that there is increased risk of bleeding, so they must come to the hospital. Okay, avoid alcohol, avoid double dose, avoid cranberry juice, any over the counter medications, particularly NSAIDs, ibuprofen, any other medications, any other medical illness, for example bleeding disorders. So you have to, and you need to inform the patient of red flags, that any if you notice any blood in urine or stool, any bruises of your body, any head injury, then you need to come back to the hospital. Okay, so that we can assess you. This is, you have to answer all those questions. Can I take the medication with the TV show? Yes, you can take it. If you have a favorite TV show in the evening, you can take it with your TV program. In this way, you won't be missing any dose. Okay, take it when the program starts, and take your medication. Why should I take this medication at a particular time? I've already answered it, because we need to maintain certain drugs need a certain level of medication. We need to maintain a certain level of medication in your system. So that's why you need to take it at that time, exactly at that time, every day. And how long do I have to take the medication? You have to take the medication. It would be decided by your consultant or the GP who is giving, because there are risks of developing clots. So you have to take this medication for a longer period of time, maybe 2-3 years, or even lifelong. Okay. And do I have to take medication every day? Yes. What time should I get the blood test done? You need to do the blood test in the morning. How often will I need to get my INR checked? Initially, we will be doing it daily for 2 weeks, followed by we will be doing it thrice weekly, then twice weekly, then once weekly, and then we will be doing it monthly basis. And what test do I have to do? Is a question. If there are no more questions from patient side, time is left. What should be our approach? Basically, the station will be longer, but if there are no more questions, these will be the questions when you start the station with the patient. So the patient would be asking, you need to explain this medication. So if there are no more questions, then you can just finish the station by giving some information, such as you can offer leaflets, you can safety net. Okay, you can warn about risk factors, you can safety net, and even still you have got time, then you can offer leaflets, and you have finished earlier, you can just sit. There are certain stations where you finish consultation in 6 minutes. You can just simply sit politely, sit quietly over there. Okay. And now let's move on to another scenario where the patient is having high INR on warfarin. So here if I do in GP, patient is 40 years old, male patient, referred from anticoagulation clinic. He was diagnosed with DVT and on warfarin. He was also diagnosed with pneumonia 1 week ago and treated with clarithromycin. So here is the clue, that there are certain medications which increase the drug levels in the body. So warfarin, so they increase the concentration of the warfarin because they inhibit warfarin. They inhibit warfarin degradation, or so they inhibit the enzymes which are responsible for eliminating warfarin. So the nurse has noticed his INR is 6. They have referred him to you, nurses ask you to speak to the patient and address his concern. Questions are you going to give me anything to decrease the INR? It is INR. And I told other doctor that I am on warfarin. Why did he prescribe me this medicine? So INR protocol might be given. It would be there in the cubicle, or it may be outside. Most of the times it will be in the cubicle. So you just have to look at the INR protocol. If you do not remember, no worries. Better to remember it. But if you not remember, it will be there. So what you will be doing is you will be following INR protocol. So in this case, INR is 6. So you are going, how you would start this scenario, start with grips. After that, paraphrase that I've been asked to come and talk to you because we found that you have INR, which is a test we do to check how thin your blood is. Okay. So I've been asked to come and speak to you to find out any reason which has caused this high levels or high concentration of warfarin in your blood, or why your blood has become so thin. So take the history of DVT from him, like I've told you earlier. And when did you develop it? What symptoms did you have? When were you diagnosed? What treatment are you on? How long have you been taking it? Are you taking your treatment regularly? And any problems so far? And then any bleeding issues, rule out any bleeding problems, any bleeding in stool, any bleeding in urine, any bruising of the body, any nasal bleed, any bleed from ear, all those things. Okay. And then take history of pneumonia, that I understand you had pneumonia. So how are you doing with your infection? How are you doing in terms of pneumonia? And can you tell me what symptoms did you have? What did they tell you about your diagnosis? And what about the treatment? What treatment did they give you? Are you still taking that treatment? Okay. And ask about warfarin, that did you take any extra dose? Okay. And look for interactions. Are you on any other blood thinners? Do you drink cranberry juice? Any over-the-counter medication such as aspirin, ibuprofen, NSAIDs? Okay. And ask about alcohol habits. And then you do quick systemic history. And after that, examination, observations, check for any bruises, and then explain that unfortunately your INR, the score with which you check that how thin your blood is, quite high, and it is likely due to interaction with antibiotic, that is clarithromycin, that you took for pneumonia. You have to explain it. And according to the guidelines, what we need to do is we need to omit warfarin, and we will be starting this medication once the INR comes below 5. And INR, initially you had this test done weekly, but we will be doing this test daily until it normalizes. Okay. And then you have to safety net if there are any bleeding problems, or if there are any bruises, any you feel any headache, you need to come back to the hospital, and you can offer leaflets for warfarin treatment. Okay. And coming to his questions, that doctor, are you going to give me anything to decrease the INR? So you would say that at the moment you do not have any bleeding, and that's why you do not need any extra treatment. Only what we are going to do is we are going to stop the medication. We are going to omit 1 of 2 doses. And if you develop any bleeding, then we can go for further treatment. And then I told the doctor that I am on warfarin. Why did he prescribe me this medication? To tell him that I'm not really sure what exactly happened, that why were you given this medication? But I can find out, I can go and check it with my colleague and then come back to you. Would that be okay with you? Okay. Yes, normal range is 2 to 3. Okay. Its normal range is 2 to 3. Normal INR range is 2 to 3. And there are guidelines which state that it is when there is INR is high, it's 5 to 8. Then there are guidelines. If there is no bleed, then you omit 1 or 2 dose. 1 or 2 doses, and then you restart when the INR is less than 5. And if there's minor bleed, then you omit warfarin and give vitamin K IV. Okay. And then the normal, and if INR is more than 8, okay, no bleed, stop warfarin and get hematology. Get an advice from hematologist. Okay, if minor bleed, and then you have to stop warfarin, admit and give IV vitamin K. And if there is major bleed, for example, subarachnoid hemorrhage, then you have to stop warfarin, admit the patient and give prothrombin complex. These are the protocols for warfarin treatment. Warfarin treatment. Okay. And then, okay, there is another scenario where we have a high INR on warfarin patient with learning difficulties. So patient has got learning difficulties. So the only tip over here is the difference here is that patient is having some difficulties. So you need to address this issue that, okay, uh, I understand you will be starting normal with normal approach, grapes, paraphrase, ask about DVT and ask about admission, why was he admitted, ask 4 questions, why, what symptoms, what investigation, what medications, and what was he told about the diagnosis, and what he was told about his condition. So once you have told them, you have asked it. Tip here in this learning difficulty scenario is that when you are going to explain this to the patient, you have to come to the level of the patient. You have to identify what difficulties are they facing, whether they are able to understand the information or not, whether the problem is understanding information, whether problem is with retaining information, whether problem is with medical jargon, whether problem is with someone speaking very fast. Okay, so there could be different problems. So you need to ask, you can ask that, okay, I understand that you might not be knowing in this station that this is a scenario of learning difficulty. Okay, it won't be given to you, it will be given to you. Patient has come to you, he has high INR, or patient has come to you with some concerns, please talk to him and address concerns. And then you have to ask, when you will start asking about all those questions, when you will be starting normally, then when you start explaining the diagnosis, that, okay, I understand you were admitted few days ago and you had DVT, and patient might make some faces, he might make some strange faces, that DVT, what is it, what are you talking about, doctor, I don't know. So he might make faces, and he might get like, you will be taking this non-verbal cue that there is something wrong, something going on with the patient. Patient is unable to understand. So you have to explain the patient very in a very understandable language. You will be telling the patient that, okay, because everybody, patients will be knowing, patients do know about water, honey, normal things. Okay, so you will be telling that, okay, let me explain it to you, that you had a clot in your leg. In our body, the blood runs like water, but due to some reason, it can become thick like jelly or yogurt or honey. Okay, if you have that clot or that jelly like structures in your blood, okay, it can cause pain. That is what has happened to you. In order to treat that, we have given you tablet warfarin. Okay, can you repeat after me, warfarin? Patient might repeat after you, warfarin. And then you have to tell the patient that, okay, for the next 2 weeks, we will be doing these tests called INR, which is to see how thin your blood is, to check levels of warfarin in your body or in your blood. So we will be doing a test called INR. And then for the next 2 weeks, we will be doing it daily. So you have to come to the GP practice, or you can go to anticoagulation clinic for that. You will be coming in the morning. We will be doing the test, and in the afternoon, we will be calling you to inform you about the results, and if there any change which has to be made to the dosage, then it will be conveyed to you, and it will be made before the evening dose, okay, or before the next dose. So there are different colored tablets. Based on your INR, we will be deciding which medication or which dose is suitable for you. There may be tablets, you might be taking pink, brown, or blue. Okay, we will be adjusting your dose based on your INR. And it is better to take this medication in the evening. And do you have any specific or any particular thing in the evening? He would say, yes, doctor, I have a TV show. So you will say that that's perfect. That's fine. Okay. So what you can do is you can take this, your Warfarin or your tablet with that TV show. Whenever you are going to, whenever the show is going to start, you can take your tablets in this way. You are not going to miss any dose. Okay. Make sure that you do not take double dose, avoid missing the tablets, and then tell him that, do you understand? Have you got it? And explain in a slow pace, okay? And ask about alcohol, cranberry juice, over the counter medications, ask about all those things which I mentioned earlier, okay? And tell him that do not take any other medications from pharmacy, and warn about the side effects, and safety net about that. If you develop any head injury, if you feel any, if you experience any bleeding in stool, in urine, or if you if you notice any bruising of your body, so you need to come back. Okay. So you also need to inform your dentist that you are on warfarin, and you have to take warfarin for a minimum of 3 months. Okay, the answer, I answered the question that before that, it is minimum of 3 months, and it can depend on your specialist advice that how long you have to take this warfarin. All right, minimum of 3 months, and uh, rest, it depends on specialist advice based on your INR. And then there are scenarios. What happens is that you have to, the key here in this scenario is that you have to ask, and then you can ask the patient. If the patient do not understand this information, patient would say, doctor, I do not, I have problem with memory, and I have problem retaining information. So it becomes easier for me. So you need to ask that, okay, what is it that you normally do to help yourself to understand things or to retain things? So he would say, doctor, I usually make sticky notes and paste them on my refrigerator, or I ask somebody or to repeat, and it becomes easier for me to, if somebody asks me to repeat things after them, I remember things like that. Okay. Or what is it, what is normally, you first question, your question should be that, okay, that can you tell me what is it that you find difficult to understand, or what is it that you find difficult to understand, and uh, what are normally the challenges that you face in understanding. Okay, whether it is understand a problem with understanding, whether it is retaining information. Okay, so what you will be doing is you have to explore what kind of learning difficulty patient has, and you have to deal accordingly. If somebody can't retain information, you can write it down for them. If they do not understand, you can ask that, how do you understand? Would you like me to repeat it for you? Can you repeat after me? Okay. And the people, those people have sorted out some ways, they have some hacks to understand things. So you can ask them their way. Okay. So the next scenario is follow-up scenario: patient with learning disability or difficulty, FY2 in anticoagulation clinic. 45-year-old has come for follow-up. He was diagnosed with DVT 6 weeks ago. He was given warfarin. He has some learning disability. Okay, it has been mentioned here clearly. His target INR is 2 to 3. Normal range is also 2 to 3. Okay, they have given you last 4 weeks INR, which is week 1 was 1.2, next week 1.4, third week 1.5 and 1.3. So it means his INR is continuously low, which means that he is not regular with his medication, or he is taking wrong dose, or he is missing some dose, or whatever may be the case. Nurse Smith, who usually takes blood from the patient, has asked you to talk to the patient and explore the reason for suboptimal INR and address his concerns. So, same approach, similar approach. You will be asking the patient that, okay, maybe that he might ask when you meet the patient or greet the patient. Patient may ask that, okay, where is that nurse? I like to talk to that nurse, and then you can say that, okay, I'm doctor, I'm here. She or he has asked me to talk to you about your blood test results. What do you understand about your condition? And ask all those questions. What symptoms did you have? When were you diagnosed? And what did they tell you? What treatment are you on? Are you taking that treatment regularly? How do you take this medication? And explain it to him, that you have developed. Talk to him about his condition, that you develop clot, and explain in the similar fashion that what is a clot, that when blood becomes thick and it becomes jelly like, so it obstructs the flow of the blood, so blood cannot flow freely, and that is why you experience pain. And you need to explore, and then you need to ask, okay, you need to explain, because you have been given the blood test results, INR test results. So you need to explain that, okay, look at this. I've got your blood test with me. Your target is between 2 and 3, but unfortunately, we are not achieving it, and we are having it 1.2, 1.4, 1.5, and 1.3. So it means there is. Do you think anything that could be the reason for it? So you will be asking that. He might say, oh, I don't know, doctor. Then you can tell them that, okay, you can ask that, okay, how can you tell me that, how do you take this medication? Then patient would tell you that, doctor, I take this medicine only when my leg hurts. And here is, you have found it, that, okay, why do you take this in that way? We didn't even ask you to do it in this way. And then you need to tell the patient that, look, maybe whoever the patient, for example, Paul, look, Paul, this is not the correct way. If correct way of taking medication, you have to take the tablet every day, regardless of the pain, whether you experience this pain or not. Otherwise, you will have the same problem again. And also, you need to take the tablet at the same time. Okay. And do you do anything particular in the evening around 6 a.m.? He would say, yes, I have favorite TV show. Then you can say that, okay, you can take this with that TV show. Okay. And then you can mention about that, I understand that you have some learning problems, you have some challenges in learning. So can you tell me, is it problem learning new things? What sort of challenges do you have? You can ask those things in the beginning. Okay, because you have already been giving some learning disability clue in the scenario, so you can ask, so that you should go at patient's level to make him understand. And you will be warning him about side effects, tell him which things to avoid, like alcohol, other medications, cranberry juice, aspirin, ibuprofen, NSAIDs, and also taking any medications from the pharmacy, and informing his dentist. And okay, you can tell them to drink some other juice, like orange juice or some mango juice. Okay, but not cranberry juice. And also tell them, do not make any drastic changes in their diet, because vitamin K is present in fruit and vegetables. So do not make any drastic change in their diets. Okay. And if there is any bleeding, they can come to GP or anticoagulation clinic, or they can go to hospital. So the next scenarios are of negotiation. So we have negotiation stations. Negotiation stations are basically, you do not have to finish the consultation on the same day. Okay, you provide time. The thing is that First of all, you discuss the issue, that what is your concern, what are you concerned about, or what is the issue. You have to discuss it with the patient or the relatives. And then secondly, you give the patient or the relatives time to think, and also advise them to discuss them with other relatives. Okay. And thirdly, you will also discuss, you need to discuss it with your seniors and get their advice, that what do they say about this. And lastly, make a follow-up appointment. So this is basic approach to negotiation stations. Now you do not have to impose your will, or do not have to tell them to do it, to decide it today, to decide it while they are in front of you or in the same visit. No, you'd give them time to think over it and discuss it with their family members, that what do they have to say about it. Okay. And then let's begin. These are easy scenarios. I guess 3 or 4 scenarios, hardly 3 or 4 scenarios. So let's quickly go over them and go through these scenarios. Okay. So I have negotiation. Wait. Let's quickly go through those scenarios. You are FY2 in pediatric department. 19 months old baby boy has been diagnosed with neuroblastoma. It is unfortunately a tumor of the eye, okay, which it stems from that nervous tissue, and disfigures the eyeball, and it's really bad looking. And has been on treatment with chemotherapy. He has been feeling ill frequently and is admitted with neutropenic sepsis. Other information: child is responding well to the treatment. His mother has been with him since admission, and he has been giving him green colored juice. The nurses have spoken to her, but she continues giving him green juice. Talk to her and address her concern. Okay, so basically, mother is trying to give a green juice, a herbal medication. She has got it from one of her friends or wherever she has got this from. So she is giving this juice to her child. So the approach would be, you will be starting with the grapes paraphrase, that I understand your child is admitted to the hospital. Can I ask a few things about him? What do you know about his condition? Has anybody explained to you about his condition? What have you been told about his treatment? And then explain that he has sepsis, which means that infection has spread in his blood, and he's receiving antibiotics, and he's also in chemotherapy. Try to be very friendly with this patient, okay? And you need to ask that, okay, how is everything going so far? Has the staff been helpful? Okay, and then discuss the issue of the concern. After starting this discussion, discuss the issue, that I understand that you have been giving your child green juice. And I assume that you give it to him to make him feel better. But can I ask you a few questions about the juice or about the drink? Can you tell me, where did you get this drink from? What is it? Do you buy it? Do you know anyone who has ever used this drink? Or do you use this drink yourself? Okay, she would reply, the doctor, I have got this from my friend, and she got breast cancer, and she used this juice and she became well. So then you have to explain the problem, that can you tell me that how important is this for you to give this drink to your child? Because we are a bit concerned about this drink. We are concerned that this may interact with the medication that he is receiving. Herbal drinks may have side effects as well. And it is usually advisable not to take herbal drinks if you have condition that can lower the immune system, as is the case with your child. As your child has cancer and his immune system is weak, he can develop side effects and it can worsen his condition. As there is no information about the side effects of herbal drinks and interaction with the medication that we are giving him. So this risk, there is a risk that this could happen. And this medication could be very good, but it may also have serious side effects as well. We will never know about it as there is not enough research or scientific knowledge present. So generally, we advise not to give herbal medications when we are giving this chemotherapy or antibiotics to your child. And then you will tell give her time to think over it, and then you tell her that, okay, why don't you think about it? Do you think you can discuss it with? Why don't you discuss it with your other family members? I will also talk to my seniors and see what they advise, or I'll go and get advice from them as well. And you will be telling them that, okay, you can take time to think over it, and we will meet again and discuss over it, and then make a follow-up appointment. Okay. Mom will tell you she has some concern. She will tell that, doctor, am I the one who has caused this sepsis? So yeah, you have to tell that, I'm sorry that we have given you this impression. Please do not think like that. Actually, sepsis is caused by chemotherapy, because immune system has become weakened. So that's why it has caused sepsis. And when people get chemotherapy, they can develop sepsis. So chemotherapy could be the possible reason for sepsis. Okay. And mom might tell you that my friend who had breast cancer, she used this drink and she's fine now. And then you can tell that, okay, you can ask that, was your friend on any other medications, any other treatment? So then you can say that, okay, I do not, she might have benefited from this drink, but as actually I do not have her notes here with me, so I cannot comment on her. I have your child's notes with me. Okay. So I'm concerned about your child. And let me tell you that let me tell you that there are very good treatments options available for breast carcinoma and breast cancer, and she might have benefited from those treatment options. Okay, this is the way you explain it. And the next is religious family members. Here FY2 in the medical ward, a 70-year-old lady was admitted in the hospital. She is terminally ill. Other information, she has got lots of relatives visiting her and praying around her. Other patients have been complaining about the noise. Hospital policy states that 2 to 3 relatives are allowed to visit at a time, and the quiet time is between 2 and 5 p.m. The grandson is here to visit, and you have arranged a meeting to talk to you. Talk to the grandson about the incident, inform the hospital policy, address his concerns. So what you need to do over here is you have to negotiate about the noise. You have to bring this discussion with them. So start normal with grips and ask his name, confirm the relationship, and then paraphrase that, I understand your grandmom is admitted. What have you been told so far about her? So he would say, doctor, I know she is dying. And then be really empathetic. And I'm sorry to hear about your grandmom. So how are you coping up at this difficult moment? And are you getting enough support from the hospital? Are the staff cooperative? Okay. And then you bring your question of discussion. You bring your concern that, okay, we understand that quite a number of people visit your grandmom. Can I just ask you, how are they related to your grandmom? How frequently do you visit your grandmom? And how many times, how many of you visit your grandmom at a time? Okay. And you also gather around you also gather around your grandmom and pray for your grandmom. So how often do you do that? What exactly do your prayers include? Do you sing any religious songs? When you are praying, is it only one person who prays, or is it everyone? How important is it for you to pray for your grandmother? Okay, you need to ask all those questions, and then uh, uh, then you can acknowledge. You would say, yes, doctor, is very important for us, and all this tongue after asking after answering your questions. Then you have to be empathetic. You can say that, I obviously understand why it is important for your grandmother, and how important is it for your grandmother and the support she needs from everyone at this stage. But unfortunately, we have got a little bit of problem. Attendant would say that, okay, doctor, what is the problem? So you would say, unfortunately, some other patients have complained that you have been making a lot of noise when you are praying, So we are wondering if prayers can be done in such a way that it does not affect other patients. So is it possible for you to do it in a quiet way? Can you please speak to your family members about it? And we also have got another complaint as well, that your visitors have come to the hospital out of visiting hours. And can I please ask you that, are you aware of the hospital policy? And then you have to tell that there is a hospital policy which states that the quiet time is between 2 and 5 p.m. Or 3 and 5 p.m. During this time, no visitors are allowed to come in, because this time is for the patient to rest. Most of them are severely ill, and this time is for their relaxation. So can you please speak to your family members about this? Okay, can you do something about this as well? And then the patient, the relative might have some concern. The doctor, can I have a private room? You can say, doctor, yes, you can say that I can look into it. I can speak to the ward manager and see if your grandmom can be moved to side room or private room. Okay. And can I bring my priest? The grandson says that, and you will be saying that anyone can visit, but whoever comes, they have to be a registered visitors, and they need to follow the hospital policy. And he would say, can I put a Bible next to her bed? And you can say, yes, no problem, anyone can follow their religion. Okay. And then then he will be asking, okay doctor, can we sing for my grandmother? And then you will say, well, singing can be a little bit of problem. It can get a bit noisy, we might get a complaint again. There is a chaplain, that is prayer room for other faith, and there will be a priest as well. So you can speak to them, maybe you can arrange some prayers in the chaplain for your grandma. What do you think about it? Okay. So this is all about religious family members. And then we have, last but not the least scenario, hospital policy or COVID-19 policy. You are referred to an acute medical unit, 92 years old, who was generally unwell and has been in the hospital for the past 14 days. Her son was the main visitor, but now he has replaced by his father, who is 94 years old. Talk to him and address his concern. So basically, it's an elderly woman admitted. Initially, her son used to come and visit her, and now her husband is coming to visit her. So you need to explain the COVID policy in hospital. Both the scenarios are the same. Sometimes you get the hospital policy, sometimes you get the COVID policy. Both approach is the same scenarios. Okay. So you will be given, there is a tip that you will be given COVID policy that is inside and outside the cubicle. You may not be able to finish reading it outside the cubicle. You can go inside, introduce yourself and excuse yourself and read the policy. Okay. You can just simply go and introduce yourself. Okay, hello, I'm Dr. I'm one of the doctors working in this department. May I have your name, please? Can I check a few details with you? Okay, thank you. Can I get a few moments to look at the notes, please? Thank you. Simple. Okay. So that we can discuss about your grandmom. And then this is the COVID-19 hospital policy. Policy states that only one visitor at a time and must be registered visitor. People who have been admitted in less than 10 days cannot be visited. The visitor must be registered and make arrangement in advance. People aged 70 years and above cannot be visited due to risk of COVID infection, but exceptions can be made if agreed by the consultant and ward manager. Visitors must wash hands and wear a mask all the time. So this is the COVID policy you have to discuss with the husband of the patient. All right. So let's quickly go through this. So you will be going with that approach. Grips, how can I help you? Ask questions. That what do you understand about your wife's condition? How are you related? Confirm the relationship. What have you been told so far about her condition? What treatment he's on? And what did the doctor tell you? Take history. How are things? Take history about them. Okay. How are things with you? When did you see your wife last time? Have you been able to see your wife via online platform? Okay. What do you? Who do you live with? And do you have any other children? Is there anyone else who can visit your wife? Any other family members who would want to visit your wife? Okay, so you are talking to husband of the lady. So You have already asked about what is your understanding about your condition, and explain the policy that the hospital policy has been changed because of the pandemic. As per the new policy, only those patients who have been admitted for the last 10 days or more can be visited. Those admitted in the last 10 days cannot be visited. All visitors should wear a mask and should wash their hands. People with COVID symptoms should not visit the hospital. People who are 70 years and above are advised not to visit the hospital. The policy has been placed to protect the patients and visitors. Unfortunately, people who are 70 and above are at high risk of developing this COVID infection. Hospital is trying to protect you from getting COVID infection. Why don't you try online platforms to see your wife or talk to your wife? And then uh, you ask them to talk to your other family members. I will also speak to the ward manager if they're and consultant if there could be any exceptions that can be made. And uh, mm, let me tell you that you are taking a very high risk by coming to the hospital in period of pandemic. Okay, and then arrange follow up and give them time to discuss with family. Okay. So this is all about, and sometimes hospital policy is given that no visitors allowed, only registered visitors. Visiting hours are specified, and same policy. There is same sometimes COVID policy or sometimes hospital policy. So this was all about today's lecture.